Hi guys, I'm Dr. Apurva Saini. I'm currently pursuing my post-graduation from Savita Dental College in the Department of Oral Maxillofacial Surgery. I want to share with you guys the list of 7 most important drugs that I call the 7A'S to begin with, and these are the drugs which we commonly use, and to know about these drugs is very important for a dental surgeon and oromaxillofacial surgeon, because we use these drugs very commonly, very routinely. So the first most common drug that we use that starts with an A is the azithromycin. Now azithromycin is supposed to be a macrolide antibiotic. Macrolide antibiotic means that it's supposed to be a bacteriostatic antibiotic, which means it's supposed to stop the growth of gram-positive as well as the gram-negative bacteria. But this drug is very common and very effective in stopping stopping the growth of gram-negative bacteria. And the dosage of these drug is probably 500 milligram that has to be given in the case of OD, and that can be given PO to the patient. Orally, you can give the patient azithromycin. The drug, this azithromycin, should be given to a patient who is allergic to drugs or antibiotics such as amoxicillin or penicillins, drugs like that. The next drug that we're talking about is the second A, that is the atropine. Atropine is very commonly used in the patients who are suffering from bradycardia. That means the heart rate is very less. So atropine is a muscarinic antagonist. What it means is, the muscarinic antagonist is whenever there is a bronchoconstriction or bronchoconstriction, that's actually because of vagus nerve. The vagus nerve is very much stimulated, and that causes the bronchoconstriction into our bodies or into our lungs. So it's actually an antagonist to it. So that means it works against the function of a bronchoconstriction. So it is actually a bronchodilator. And the other function of this is also it decreases the oropharyngeal secretions. It decreases them. The use of this is definitely in decreasing in patients who have decreased heart rate, that is bradycardia, and also in organophosphate poisonings. You can use that amount of drug. The next caution that I have to be very careful in this case is Down syndrome patients, patients who are pyrexic, patients who have gastroesophageal reflex problems. In those patients, you're not supposed to use atropine as such. The dose of atropine that is very commonly used is 0.3 to 0.6 milligram intravenously if it's given to the patient. You can also increase the patient's dose to 1 to 2 milligram. That has to be given every 10 to 20 minutes. If the patient is in a severe condition, you have to increase the dose for first 24 hours to up to 100 milligrams, and then you have to give it every 5 minutes. It actually is seen when the patient becomes symptomatic. Like the patients, you can see the skin flushing in the patient, you can see the pupils are dilated, and the patient can see that heart rate is actually increased. So that means the drug is supposed to be working. In this case, the next drug that we're talking about is our very favorite and very common anti-platelet, anticoagulant drug, aspirin. So aspirin, we all know that is a COX-1 and COX-2 inhibitor. What aspirin does is it actually decreases the amount of prostaglandins that our body is secreting. Prostaglandin is something that is, what you can say is, it causes inflammation into our bodies. Once the prostaglandin levels are decreased into our bodies, what happens is this inflammation is decreased, and that inflammation is not there. That means there will be no fever into our bodies. So it is an antipyrexic and anti-inflammatory. And the other function of aspirin is it is a thromboxane A2 inhibitor. What it does is it decreases the amount of the platelets that are aggregating into our bodies. So what it does is when there are no platelets aggregation, there will be no clot formation. In the case of emboli, in the case of thrombus, so it is a thromboembolic drug. So that's very important when you're treating a patient who is a thromboembolic. Aspirin is one of the drug of choice. The dose of aspirin is definitely it can be given in the patients who have mild or moderate amount of pain, in the patients who have ischemic heart diseases, in the patients who are thromboembolic. The contraindications of aspirin is the patients who are 16 years of old or less than 16 years. If it's specifically mentioned, then you can give aspirin. But if not, then aspirin is generally not given below 16 years of age. And also in patients, because in 16 years of age or patients who have less than 16 years of age, the aspirin can cause Reye's syndrome or Ray's syndrome. It causes the inflammation and the swelling in the brain and the liver, and that is why aspirin is contraindicated in patients less than 16 years as such. It can cause or is also contraindicated to patients who have hypersensitivity or who are patients who are hemophilic. You have to be very cautious in giving aspirin to patients who are asthmatic, aspirin to patients who are on a high dehydrated, aspirin to G6PD deficiency patients, or any allergic reaction patients. You cannot give aspirin to those patients. Aspirin as such is also one of the very cautious factor is aspirin causes GI irritations. So whenever patient is taking antiplatelets such as aspirin, which is very common, you have to actually tell the patient to be actually taking an antacid, because it would cause an a GI irritation, and it could cause GI bleeding. So in the patients who are taking aspirin or anticoagulants for a long period of time, you would have a history of GI bleeding in those patients also. And the dose of aspirin is as such is 300 to 900 milligram that has to be given 4 to 6 hourly. The only important factor is you have to avoid aspirin before 7 days if the patient have tendencies of bleeding. But in the patients of having cardiac surgeries, patients is having a coronary artery disease or something like that, you can continue aspirin. As such, there is no issue with aspirin. The next drug that we're talking about is amoxicillin. Amoxicillin is actually a combination, and you can give this combination, and we generally use this combination in the case of amoxicillin plus clavulanic acid. It is called as amoxiclav, and that is 500 milligram plus 125 milligram, 625 milligram. It's a broad spectrum antibiotic, so you can give this antibiotic, and it is a very good antibiotic because it's very easily accepted by the GI system. That means you can give this drug orally, and the patients will have a lot of relief. This drug is very mild, very commonly used in patients who have mild pneumonia, patients who are having community-acquired pneumonia, listeria, meningitis, and other endocarditis, disease like that. And the dose of this amoxicillin is 500 to 1000 milligrams, and it can be given PO or intravenously also. But to be remembered is in the case of patients who have renal failure, then amoxicillin or what you call has to be decreased. It has to be decreased. The dose has to be decreased as such. The next drug that we always prefer not to give to the patient, but we still tend to give, is tricyclic antidepressants such as aminophylline and theophylline. These drugs are actually methylxanthine bronchodilators. They actually dilate the lungs. And that is the reason this is very common drug in status asthmaticus in patients who have severe bronchospasms. So you will always prefer to give aminophylline drugs. Next is the dose. The dose has to be, the point is whenever you're giving a drug that is actually like this, you have to monitor the dose, because these drugs if given intravenously will actually cause a lot of arrhythmias, and these arrhythmias have to be maintained. And that is why monitoring of the drug has to be given. So basically in the patients who are smokers, who are having the high amount of smoking and drugs like that, in those cases you can give 225 to 450 milligrams. Either BD you can give those drugs. Other than that, if not, then you have to monitor the dose because they cause a lot of arrhythmias. The next drug that we all are familiarized with, and we all try to always keep this kind of drug in our emergency kit, is adrenaline. Adrenaline is one of the drug is actually a sympathomimetic. So sympathomimetic it causes the works on the alpha receptors. Whenever it's working on the alpha receptors, it's causing the vasoconstrictions. The vasoconstriction to the blood vessels that are supplying the heart. Whenever the blood vessels to the heart is constricted, there will be increase in heart rate, there will be increase in blood pressure, the contractility and all those things which will be increased. And these are given to the patients who are having decrease in blood pressure. So you will have to increase the blood pressure. So that is why adrenaline is supposed to be a choice. This is given in the case of CPR patients and also in patients of anaphylaxis patients. And this is also one of the factors why, because in anaphylaxis where there is an excessive amount of mast cell secretions and cytokine release. So what it does is decreases amount of cytokines release into our body, and that is why this is a drug that is given in the case of anaphylaxis. This is also a beta-1 receptor agonist, which means that it causes the blood vessels to the heart to increase contractility and everything, and beta-2 antagonist, which means that blood vessels that to the lungs that are going, it is causing bronchodilation to those lungs or to those vessels actually. You have to be very cautious when using drugs like that in the cases of cerebrovascular accidents, in the cases of hypertensions, and in the cases of glaucoma. Why? Because the patients the eye volume is actually increased in this case. The blood pressure is increased to the eye a lot, and that can cause damage to the eye and everything. the side effect of this drug is that it's causing heart rate, it's increase in heart rate and blood pressure, and everything is increased in this case. So that is why in this case the patient has to be you'll see the patient will be suffering from anxiety, tremors, and headaches and everything like that. And that is why even weakness and dizziness the patient will feel. And in the case of pulmonary edema can also happen, and the dosage is not correct in these cases of adrenaline. So in the case of CPR, you can give 1 milligram, that has to be like 10 milliliters in 10,000 10,000 milligrams, like milliliters. It has to be diluted, it should not be given like that. And if you're not able to give it IV, you can give it intraosseously also. But in cases of IVs, if you're giving, there are high chances of it causing arrhythmias. And in the case of anaphylactic reactions, because that is very very common in dental chairs also, you can give 0.5 milligram. Then again it has to be given in the form of like subcutaneously or intravenously, or not intravenously, intramuscularly, and has to be like 0.5 milligram in 1000, or like 1 milligram per milliliters it has to be given. And if there is no response, you have to repeat it after 5 minutes. Okay. So the last drug of choice is acyclovir. Acyclovir is one of the most commonly used antiviral drug that we give to the patients of trigeminal neuralgia, patients who are suffering from any nerve degenerations like that. The most common drug that is given is acyclovir, and not even in trigeminal neuralgia, actually I'm sorry, you to say herpes virus and herpes zoster and those infections. So in this case of acyclovir, the acyclovir is actually most commonly used antiviral. What it does is inhibits the DNA polymerase that is happening inside our infected cells, so that they do not produce more infected cells. And it actually needs activation by the viral thymidine that is actually produced by the species of herpes only. It's very commonly used in patients who are immunocompromised, in patients who are HIV infections, patients who are, you can say varicella zoster virus infections, herpes simplex virus 1 and other infections. Even in case of encephalitis, in the case of meningitis, you have to use acyclovir only. Next thing is, like, you have to be very cautious when you're giving acyclovir in patients who are having dehydration, because you cannot give acyclovir to patients who are having dehydration. The side effects will be encephalopathy and hypertensions and seizures sometime. And acyclovir doses as such is 5 milligram per body per kg, that has to be given TDS, in 1 hour basis, and 10 milligram is given in patients who are herpes virus, varicella zoster virus, and immunocompromised patients. You increase the dose of those things. So these are the 7 drugs we studied, and these are the most commonly and the most used drugs. If I was able to help you guys in any way, I'm really glad. And thank you guys so much for listening to this. Bye.